New question, the member from Elgin, Middlesex, London.
Mr. Speaker. Speaker, my question is to the Minister of Finance. Speaker, children and youth are experiencing a mental health crisis because they can't get the treatment they need, when and where they need it. The Canadian Institute for Health Information released new data this morning that indicates that children, youth and families facing a mental health crisis are ending up in hospital ERs and inpatient units at disturbing rates. Since 2006, there's been a 63% increase in ER visits and a staggering 67% increase in hospitalizations for children and youth seeking treatment for mental health and addictions. Speaker, the new statistics are trending in the wrong direction compared to 2015, and this government is failing our children. My question to the Minister of Finance: did the Minister of Children and Youth Services request funding in this year's budget to deal with the eroding capacity in community-based children's mental health centres?
Minister of Finance.
Minister of Children and Youth Services.
Sir, Children and Youth Services.
Well, thank you, Mr. Speaker. And I want to thank the member opposite for the question. I also, again, want to recognize all of the advocates, parents and family members, and staff who are working across this province to make sure that our children are positioned for success here in the province of Ontario. Mr. Speaker, when I first became the minister responsible for this file, I was given a mandate by the Premier to work with providers to transform the child and youth mental health system here in the province. And we recognize without a question that there's more work that needs to be done to improve the services that young people receive. We are facing challenges with wait times. We're facing challenges with service delivery. We're facing challenges with our funding model. And, Mr. Speaker, our agencies have said this, the Auditor General has said this, and we've accepted this.
Answer.
This is exactly why we're seizing the opportunity, Mr. Speaker, to give Ontarians a community-based mental health system for today and into the future.
Thank you, Mr. Speaker. I'll take that as no, I did not ask the minister for any funding. Speaker, the data shows how the erosion of community services not only leaves children and youth unable to obtain the help they need, but also strains our hospital resources. The data shows that the government's inactions endanger lives and cost the systems $175 million a year. Children's Mental Health Ontario estimates that $118 million the system needs annually could save $1 billion in the long run while ensuring children and youth receive the services and treatment they need. Speaker, will the Minister of Finance explain why none of the new federal health transfer money for mental health initiatives was allotted to children and youth?
Also a good question.
Minister.
Minister of Health.
Minister of Health, Long-Term Care.
And the importance of this issue is part of the reason why we announced $140 million towards mental health services, including access to cognitive behavioral therapy, supportive housing as well, why we announced in Barrie 10 inpatient beds for children and youth mental health, as well as a set of outpatient services, Mr. Speaker. But this is precisely why OHIP Plus is so important. We know that 70% of mental illness emerges during childhood, Mr. Speaker, and for the first time in this province,
From Elgin.
those children and those youth are going to have free access to the medicines that they need to deal with their mental illness.
That's right.